The Department of Global Health was set up because there was a realization of a need for training in public health that went beyond local situations. As you know, there has been talk about community health, public health, international health, and now really global health is at the forefront of concerns regarding health in general. The recognition that the world is highly interconnected, and that when there is a sneeze in one part of the world, somebody else will be catching a cold on the other side of the world. That means that understanding these interrelationships and how they work is critical. Also understanding how same problems may pan out differently or may involve different factors in different parts of the world is so critical. And this is why we realized as a School of Public Health that there's a need for training of students in this way of thinking and understanding the way the world works and the way health across the world works, and hence the need for global health. If for anything at all, the COVID-19 pandemic has taught us that everybody is interconnected, and understanding health globally is so critical. We work in tandem with the Ministry of Health, with the Ghana Health Service, and then with the health partners in the country, the WHO, the UNICEF, the World Visions, and the many others that operate in health in Ghana, USAID, the FCDO, and several others. My expectation and hope is that we will be able to get our students to understand the way our Ministry of Health and especially our Ghana Health Service interface with some of these bodies, both locally and internationally. We, for example, have something known as international health regulations. What does it mean if there's an outbreak in a country to report, and how timely should you report? How should you go about the reporting? What does it imply beyond just health for the country and for the continent of Africa and globally? So really looking to interface with the Ministry of Health, the Ghana Health Service, and the health partners to make sure that students have that well-rounded training that they need to be able to operate optimally. Yeah, my expectation is that with the training of more global health professionals and students, we'll be able to have people trained right here in Ghana who have an outlook that goes beyond the country into the entire African continent, and not only the African continent but across the whole world. It's about time that in Africa and in Ghana also, we tell our own story, we describe our own problems, and we are certainly best placed to develop and implement our own solutions. But we cannot know this, we cannot appreciate our problems and develop solutions without a view of the bigger picture. And so what I'm expecting is that we'd have people who are better placed to situate Ghana on the global stage when it comes to health issues, and also beyond that to be able to contribute towards improvement in health outcomes across the continent and globally. Well, a global health student must have many attributes, but the singular, most important one, I would say, is passion. They need to be passionate about health and about health from a global perspective. That's the most important thing. Beyond that, they have to have a certain critical way of thinking, looking at things beyond just what meets the eye, and being able to situate what might be unique to a particular location, to a particular country, within a wider scope or context of the continent or the world. These are very important things that a global health student must be able to do.